Hi folks, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today, Brad, we're going to show you what happens when you use a brush over this area and watch what happens. I was trying to intrigue people.
Yeah, you got them coming. They're rolling in.
All right. Actually, what the video is about, we're going to be talking about upper cervical pain.
So, right, upper neck. Right?
Upper neck, and a lot of times what that can also cause or lead to is those headaches that come around. Sometimes they come around the parietal area, as we say. It can even go into the eye.
Sure.
It can be sometimes one-sided, more often than that one-sided. Sometimes they can be two-sided though. And we're going to show you some techniques for taking away the pain here and up in here.
Right, that referred pain that goes up and some people call it, it's a full wrap. When it
Oh,
comes
really?
up. Yeah.
Okay.
My brother-in-law had that from a car accident, and he'd always refer to it, I've got a full wrap going. And
Interesting.
yeah.
Like, because they call headaches global sometimes too. I think that's the whole head, isn't it? So.
Yeah, global, like the globe. Like,
Right. Yeah.
I don't want to digress.
If you are new to our channel, please take a second to subscribe to us. We provide videos how to stay healthy, fit, pain-free. We upload every day. Also go over to Facebook. Take just 1 second out of your day and go over and find us on Bob and Brad and like us, because you like us, we like you.
There you go. It's a reciprocal situation.
So let's not keep them in suspense anymore, Brad. You're just going to go ahead and take a regular brush, and there's some science behind this. When I've worked with people who have amputations,
I've done the same thing where, yep.
and they have phantom pain, that means there's pain out where there's no longer a limb.
Right,
So,
their foot hurts or their hand hurts, but they've been amputated up at the elbow level.
so what we'll often do is take a terry cloth and rub it over the residual limb. And what that's doing is it's bombarding the neurological system. It's kind of overloading it.
Sure.
So that it actually can knock the pain off. It's the same way a TENS unit works, T-E-N-S.
Sure.
Transcutaneous electrical neuromuscular stimulation. And also, if you want an example from your life, remember when you fall down as a kid?
Yep.
What's the first thing you do? You
Rub it
your knee.
out.
You rub your knee.
Right.
And what you're trying to do is you're trying to overload that sensory system. So a technique, again, we're just going to give you, this is a little bit again out there, but you can take a hairbrush, and if you want to do a close-up here, you can actually just take the brush and tap it like this.
Right on the area where you feel the pain.
Right where you feel the pain. And this actually, did you feel this, Brad?
Yeah, oh yeah.
It really does work.
Yeah.
It really does overload it. And then you can actually just take it and brush a little bit, make circles
Sure.
like this. And you can actually go into the scalp here too, because it's a brush. So you can actually go up into the scalp a little bit too.
Use the brush and then afterwards you comb your hair with it.
That's right. You look good and you feel good at the same time.
There you go.
All right, the next technique, Brad, this one actually is, a lot of times the problem with upper cervical problems is that it can be one of two things. So this is the spine. Brad, you want to stand, all right, maybe show on the real spine.
Yeah, so we can relate this.
So this is the spine. You can see the head is removed here. The first two vertebrae, C1 and C2. There's that greater occipital nerve comes out from between there, goes up into the head and around the skull, and that can often get some impingement on there or some pressure on there.
Sure.
And so that's why we're going to show you this technique. The other thing is that quite often there may be a lack of motion as far as rotating. Yep. And a lot of your rotation, I remember reading different amounts, but 40 to 50% of your rotation comes from those first two levels.
Right. Precisely. Particularly with rotation.
Yeah. So what I want you to do, the first thing I want you to do is maybe have someone look at you or look at yourself in the mirror. Maybe you can tell. I want you to see how far you are rotating. And if you have one side that you're going this far and the other side you're within normal limits, you're going to want to regain that motion.
Sure.
It's going to really help decrease your pain. It might even help stop that headache.
Right.
So we're going to show you a technique. Are you going to do it too, Brad, or not?
Well, yeah, you got an extra towel. Oh, I'll get one here.
There's a towel right
Go
here.
ahead. I'll jump right in.
So this is a little bit complicated, but follow us. So you're going to take a towel. We like to selvage.
Yeah, the edge of the towel.
The edge of the towel. So you're going to go like this, make a little cape out of it, and you're going to put the selvage right below the ear.
I'm going to...
Right below the ear like this.
Sometimes you have to have someone else do this on the back. It makes it a little easier.
All right, so what I'm going to do now is I'm going to work on going to the left. So I'm going to drop this one down, grab this one, and this one is kind of pointed up from the eyes, up by the eyes. I'm pulling down on this one, and I'm going to the left. And you're going to just give it, and this should be pain-free. This is not something that should hurt. You can give it a little bit of stretch at the end, but it should not hurt. You want to make sure your shoulder is not coming along with it. Brad, yours looks like a complete mess.
Well, Bob, you know, that's why I do it.
You don't have the selfie.
Can we show them the way I do it? It's a little easier. I have a different method, but
Well, this is one you want to really get up in that C1, C2, Brad. So
well, you know, that's why I'm gonna. People
All
have
right.
problems like me. This is the. See, I was leading into something. You thought I was just.
I
making a
thought you were
mess of-
goofing off, but yeah, he actually, this is the.
yes, Bob, you're killing me.
This is the stretch out strap. You
Yeah.
can find it out in the Amazon section below. But this really works well because it's thin and it really
Right.
gets into that area.
And if you have fingers or arthritis in your hands, you have a hard time grasping, it really is a big advantage. It's easier to do that. And then you can
And
just,
yeah, again, make sure you're underneath the ear, up by the eye almost,
Yep,
Brad.
There you go.
So let's go the other direction, Brad.
Sure.
Okay, so now we're going to go to the right. So again, we start here. I drop this arm down. I grab this one. I pull this one is going straight down, not across like this. You'll be choking yourself. And then you pull it across like this. And I have seen this work really well with people who have a lack of motion. And again, this shoulder's not coming along with me.
Yeah,
Sometimes people even hook it around a chair to stop it from coming with. And you can do like a good set of 10 reps. You can do
Sure.
these every hour if you
Yep.
want to, you know, as a good way to help stretch it. So again, pain-free. That's the thing we want to emphasize with that. All right, the last thing you can do is, we're going to show you a couple bonuses too, but if you want to face this way, Brad, so we're going to show the massage.
Sure.
So you can actually just take your fingers and massage along the base of the skull. And you can do little circles and work your way around, you know, work your way to the edge. And then you can go ahead and do more of like a spleen massage where you put your two fingertips together and just pull them apart. Brad's demonstrating that quite nicely there.
And this actually incorporates some of that theory you're talking about with the brush, because like right
Sure.
now when I'm pulling, I'm actually tugging on my little hairs a little bit and creating a little bit of
Sensory overload.
Exactly, sensory overload. You know, next week I'm getting my hair cut. We should have waited till then.
I'm getting my hair cut too.
Oh, really?
Well, a little hippie.
Yeah, which reminds me, guess whose birthday it is today?
Well, we're filming today on the 14th. It's not today. I don't know when this video is going
Still,
to go up.
he's in his 50s.
Yeah, well into my 50s, heading down to, you know, they say the banana peel on the one foot and the other foot in the grave.
Yeah.
Make sure you have good posture while you're doing these. Really want to
Right.
make sure you're in really upright posture while doing all these exercises. The bonus ones that you really want to do, make sure you're doing chin tucks.
Right.
I mean, I know we mention these a lot, but you want to make sure that really loosens up that upper neck.
Yeah.
So as you can see again, you don't go down like this and you don't go up like this, you just go straight back. And then finally, this is one I've had some people have good luck with. They take their fist and put it
yeah.
underneath their chin and they pull on their skull a little bit. Again, this is you can't be too aggressive with this one because you can really actually get a lot of leverage.
Sure.
You can see the thumb is actually down here. Yep. And give it a little pull here, just it gives a little bit of stretch. And it stretches that upper cervical spine out.
Yeah, I like
Oh.
that one.
Glad your head didn't pop out. You really had me going on this one, by the way. I can't believe that I believed you on that. So,
Yeah.
all right. Remember, Brad and I can fix just about anything.
Except for the broken heart.
Yeah.
We could lasso it with the
That's right.
stretch out strap.
There we go.
We got to put this in the protocol.
But we're working on it.
There you go.
Thanks a lot.